And I think that it's important for you to realize that, like, if you haven't had this, this is real. I've had it personally, and I just had it 48 to 72 hours ago, and it's real. I still battle with this. And so, hi everyone, welcome to the podcast. Welcome all new listeners. Welcome back to those who have heard my podcast in the back, and you guys are back for another episode. Welcome back. Today's episode is near and dear to my heart. I wanted to share a little bit of my personal journey through back pain, the people I've served at all levels, professional athletes, community members, whatever it may be, just to give you a little bit of insight into how I manage low back pain at all levels of athletes, and then also just to give you a little background story on and why I manage it that way. So before I go into it, I just want to give you a little update on what's happening in my life, in sports performance life, and just everything around it. My kids are doing amazing. Those who have heard my podcast in the past, my son Jacob, who is 4 months old now. Yes, if you've been following my podcast, I've been mentioning just kind of his general updates every single week. He is just an incredible human being. I love watching humans grow, and that includes my kids. And it's just amazing to watch the development. And my kids are doing great. Sports performance has been amazingly busy. We have a new location, which I released on the last podcast, and we're just getting renovations going. Every single day has been progress, and this weekend is a big weekend for us, and we're going to release the location next week, so really excited for that. It has been just a general, like, an interview and growth mode week. We've had several interviews for several different positions, and I have to share this on the podcast. I'm passionate about the people in my inner circle and those who are extended family. And the minute that we released that we were going to have a new location, there were so many people who reached out and said congratulations, and also, hey, listen, what opportunities are there? And first and foremost, thank you guys. I respect and love and appreciate every single one of you, and I think that our world is only going to grow with amazing human beings. And so, just when I released the podcast, people were like, "Hey, Tom, I heard it on your podcast. What are you doing? What do you need help with?" I just want to say thank you. The people who have extended their help, and those who are interested in positions in the future, I'll be in touch with you directly. But there's stuff down the pipeline that we're working on right now. So thank you guys for reaching out. But there's some really good opportunities coming up. So thank you. All right, on to this podcast. Let me tell you a story. In 2000 and I think 2018, I was traveling with a no no 2000, 2015. I was traveling with a professional tennis athlete, and it was one of my first stints working full time with a professional athlete, and I loved every minute of it. And what I didn't realize, everybody talks about, like, oh, you work with pro athletes and you get to work with them full time, and what's it like? And the story I want to share with you is really about my injury, not necessarily what I did with this athlete, but more of like what your body takes a toll on while you travel with pro athletes. So in this time, I was working with a pro athlete, and what I failed to realize is the weight and ergonomics of having a treatment table with me at all times. So I was traveling US to Europe, Europe to US, and back and forth with a normal wooden um, treatment table. And I learned a lot about ergonomics and like what table I would use, how much weight, because here's what happened. I was in England at the time, and this pro athlete was interviewing me. And we were just going through like just normal motions. I would take him to practice. I would take him to the game, and he would say, hey, this is what I need. Can you stretch me out? Can you work me out? Hey, what do I need to work on? What's my corrective exercises? What do I have for the evening? What do you have planned for the whole day? And I would map that out, and that was fine. And we would go from an airplane to a hotel, hotel to train, train to a new facility, facility to new hotel, hotel to new facility, and you just keep going back and forth. And because of that, my body took a toll, and I wasn't ready for this. I didn't know how big of a deal, how much rotation and load is being placed on the spine. It was the first time I ever gone to Wimbledon, and we were in England, and we were prepping for the main kind of stage, and we were getting things ready. And he says, "Hey, we need to be ready to go for our first round tomorrow." I said, "Yeah, no problem. Do you mind if I get a workout in?" He said, "Yeah, yeah, no problem." So I went to go get a workout, and I love bench press. So I have these dumbbells. I think I don't know, 50, 60, 70, whatever it was. So I have dumbbells, and I put one on my left side, and then I put one on my right side, and my back goes out. And I literally am stuck with 50, 60-pound dumbbells on my shoulders. I'm in the hotel, and I'm in an interview process with this person. So I haven't locked down a permanent contract. And I am so afraid of losing this opportunity because it was everything I've ever worked for, and it was the opportunity of my lifetime. And I wanted to keep the contract. I wanted to earn it. And so I didn't want to tell him what was happening. So I put down the dumbbells, and I could barely walk. Like my back was seizing up. I'm like, oh my gosh, what do I do with this? And I didn't have anything shooting down my leg, but I have it across my low back and even into my SI. And it was the first time, no, second time I'd ever experienced this. And the first time was like maybe 8, 10 years earlier. And I was very fearful, but I'm in England with no other resources, and I didn't know what to do. And literally the next morning, he says, "Hey, are you ready to go?" I said, "Yes." And I could barely walk. I could barely walk. So there I am. I have a table of 30, 35 pounds. I can't even walk. And I have to lug this to the facility, treat, and work on this individual, be able to help them, stay healthy and active, and especially in preparation for a competition. And so here I am with the most excruciating back pain I've ever had. I can barely walk, and I have to fake it till I make it. And I don't know if I ever shared this with the athlete. So if he hears this, here's the backstory of it. But I get him to the facility. We start practicing, and I can't believe it. I was holding in every ounce of it. I took no meds, and it hurt tremendously. And in hindsight, and I'll express kind of just a little background story of what happened recently and how this impacts it. But I learned a lot about back pain and how I used to treat it before and how I treat it now. And why is that different? Because my framework and what I can empathize with the people I serve is different. Nonetheless, I got through it. It took me 48 to 72 hours of just like pushing through it, and amazingly, it just went away. In hindsight, I was actually concerned. I was like, this is serious, but I had no choice. I had to carry this bag plus treat this individual, like when you're stretching or mobilizing a hip or whatever it may be, that's a decent amount of load. Plus, if you're doing like belt mobilizations, you're working on somebody, you have to hinge. That's a lot of work on the spine. And for those of you who have had back pain and try to treat that same day, you know how rough this is. But my job was on the line. I didn't want to lose the contract, so I went through with it. And I'm glad I did for so many reasons. One, to earn the contract, but two, because I learned so much about my back pain and what I can push my patients and clients to also understand with back pain, in that movement is truly medicine. This was my second episode with low back pain, like just like this, and it hurt tremendously. However, I learned a lot from my personal self, and then also from my patients and clients. Now, most recently, I have to share this. I hurt my back about 2-3 days ago. I was doing deadlifts and low load, 225 pounds, easy, just repping them out, no problem. I pulled just slightly. I was on rep number 3 or 4 out of 4 or 5 sets at 225, and it was like nothing I've had any issues with in the past. I pulled, and I could like feel this low back strain across both sides of my low back, predominantly my right side. And it was a running workout combined with deadlifts. And I could feel it a little bit, but I could barely hinge. So I stopped deadlifting and I just continued running. It was no problem. I can run. And then a couple laps in, going into a half a mile, I could feel it, and it hurt just to even place weight on my right side. And afterwards, I couldn't even sit down. I couldn't hinge. I was like, this is definitely my spine. And as I went through it, I knew from 2015, I knew I had to just keep moving. Like I knew it's like the key to recovery. And now I'm 48, 72 hours later, and I'm 60%. However, let me share this story and why it's relevant to the people you serve. And if you've had back pain, good for you. You know what that feels like. If you haven't, whether you're a first, second, third year student, new grad, established PT, if you've had back pain, you can understand what that feels like. And I want to share this so you can better communicate with your patients, clients. But then also, if you've never had it, you got to understand and how the people, what like the mental aspect of going through low back pain feels like. All right, I am a clinician. I understand. I've been through the schooling. I understand the mechanics, and I was still fearful because of the apprehension, because I know what that feels like. And I was like, is this serious? Is this a thing? Is it going to be permanent? Do I need something major? Do I need an MRI? Do I need an X-ray? And I'm a clinician. I live in this world, and I automatically went to that. It took me like 24 or 48 hours to be like, all right, bring it down. Hold on, relax. And I think that it's important for you to realize that, like, if you haven't had this, this is real. I've had it personally, and I just had it 48 to 72 hours ago, and it's real. I still battle with this. And so I had to figure out what the root of it was. And the root of it was I was doing the deadlifts outside on a small little decline in the cement. And so one of the bars was slightly at a canter. And when I pulled it up, that's what happened. In hindsight, now what I realize, I have an SI issue. And okay, most patients and clients can't decipher that, what they're coming in with. So you have to see the whole process to somebody who's had back pain. They probably, if they had the same experience, they probably had the back pain, went to an urgent care on somebody who knows very little or cares very little about biomechanics. They're like, are you losing a limb or are you dying? No. So here's meds and get out. Talk to your primary care and figure it out from there. Okay. You got to imagine somebody is fearful of, is this an issue and is it permanent? They're now going to wait, I don't know, 48 to 72 hours, maybe on Monday, Tuesday, they call their primary care. They can't get in for a week or two. Here they are figuring out, do I need to call up at work? Is this going to be the rest of my life? There's a lot of trauma that happens in that. And they finally get to see their primary care, and the primary care says, hey, you know what? Just take 6 weeks off of everything. It'll be all right. Here, take some meds. And for somebody who's active, that's the worst possible case. And I think you guys understand that as listeners. I was just talking to a client recently, and actually today, and he says he just had surgery, and he said, Chris, I'm really thankful for the feedback that you gave me and what to expect off of this trauma, and then what the surgeon's going to tell me, and then what my health insurance is going to tell me, and what should I expect, and then from there know what to do afterwards. And I said, what was the biggest thing off of that? He said, I always knew that how the healthcare system works, and your expectations help me realize what I need to go past and I need to go beyond. Before, I would have trusted every single thing, listened to every single aspect, and assumed that they had my best interest. And for those who've listened to me in the past, I am all about the patient and the client. They deserve the absolute best, and I'm so honest and upfront and transparent with the people I serve. Why? Because I think that if you don't communicate that, it's never assumed. Just because you have a degree in sports medicine, healthcare, whatever it is, don't assume that every single person in your world knows exactly what to manage. So if you asked your mom and dad, your aunt, your uncle, and you assume that if they had this excruciating back pain, what would they do? They probably wouldn't do exactly what you did. And they would still have the fear, the anxiety, and even no matter what you said, because you're family, they're not going to have the same trust. And so my point to this is that when you communicate with people, you got to tell them exactly what is wrong and what's going to happen and what to expect when you go into a system of healthcare that may or may not have the best interest in them. I think that's so important. So let me share how I manage back pain and how I got that framework. So I used to work in pro athletics, just over a decade. I did a residency. I worked at the Olympic Training Center. I worked pro sports. I travel with people individually. And my framework to manage low back pain has changed dramatically over the last decade. And why? Because the more people I serve, the more athletes I work with, the more I engage in healthcare, the more I engage with orthopedic surgeons, primary care physicians, the more I realize the sequence of events that happens after low back pain is massive to the outcome of the patient and the client. So, where do you fit along the spectrum, the timeline when somebody gets hurt? I think you have to understand that. So, when people have, say for instance, they have a case of low back pain, they have a flare up. When you see them, how many times have they had low back pain prior? How many clinicians have they seen? How many providers have they seen? For me, I'm a very aggressive provider for low back pain. And what I mean by that is I will push people to move, to push past their limit with low back pain. Why? Because I felt it. I've worked in pro athletes. I worked with pro athletes. I've worked with people who've had low back pain. And I know that as long as it's not like encroaching on their spine, I don't have a significant herniated disc, that movement is the best thing for them. And you might say, well, I've known that for years. Like, great. But your ability and confidence to communicate with the people you serve is important. You have to literally verbally tell them and look them in the eye and say, if you don't move, you're going to be worse. And what I'm telling you right now is going to help you for the next 48 to 72 hours. After that, I need you back in here because you're going to question everything I'm talking about. It's going to be better, but not to the point where you want it. And then you're going to continue to process whether this is the best thing for you. I promise you. Come back, work on these exercises. I'll work on it again. I'll give you more updates. But it's better than taking 4 to 6 weeks off, like a lot of people will tell you to do. And I think that most healthcare providers have been given this information, but most people don't see the acute care management, even the subacute, just because of the healthcare system. So, if you've ever run into anybody who's had low back pain, movement is truly medicine. And I talk about that from personal experience. Man, I questioned whether my back was severely injured in 2015 and even 48 to 72 hours ago. I'm feeling better now, but I had to force myself to get into the gym yesterday and today. And I know that it's the best thing for me. I'm, like I said, 50 to 60% better. But even me as a healthcare provider with this history and past experience working with people, I still have to struggle with that. And I think that you need to remember that as a provider, that these people need to be told explicitly, like just all transparency, you need to move. If you don't, you're going to get worse. And look them in the eye. Just like have a big upfront conversation because they're not going to trust you. Anybody who's ever had anybody in front of them with significant pain, they're super skeptical, rightfully so. So, on the acute and subacute side, I think that truly, if you ask me, Chris, what's the secret sauce? Like, how do you get people better in that acute stage? And I've learned through a lot of new grads, a lot of students, less is more. And here's the errors that I see. Third-year students, new grads, even in that first 1 to 3 years, if you've never seen acute care management and you've never dealt with a fresh low back pain patient or client, your instinct is to manage them just like you would with a chronic low back pain case. You go straight to the McKenzie side, or you just want to go deep tissue. You want to mobilize or manipulate or whatever you call it, and you want to be aggressive because you want to have that outcome. And I share this with my team consistently. Less is more. Don't flare them up. Don't flare them up. Because if you reset that whole healing process, you've lost all of their trust. And I think everybody who's listening to this and every provider wants to be the superhero, the Superman, Superwoman. They're like, I want to be the one that gets you better. On acute and subacute pain, less is more. Don't adjust them. Don't overdo it with the correctives. Don't overdo it with the McKenzie. Don't do extension. Just less is more. Get them to the next phase of healing, and then you can start to do that. But I've learned with a lot of third years and new grads, and in the 0 to 5 year range, you learn that that doesn't work in the acute and subacute phase. And maybe you've dealt with acute and subacute low back pain, and you've been able to be successful with that. But for most people, they've never had that opportunity. So what do? They use what they know and apply it to what they don't know, and that's hard. It's a whole different ball game. So in the acute and subacute phase, less is more. Mobilize them, keep them moving, keep them on the right path, give them the bumpers, meaning, hey, you just got to keep moving. Don't go deadlifting or pulling things off the ground. Don't baby this and not move for the next few months. You literally just have to keep moving. Stand, go to work, drive, do all the things that you need to do. Keep them on the right path. Come back within the next 48 to 72 hours. Keep them moving. Give them the guidelines. Now, that's very different than chronic low back pain. I get that. But what I'm saying is, on the acute and subacute side, if you've never seen this before or you don't deal with this regularly, don't consider it normal low back pain. It's a whole different ball game. I've dealt with this personally. I've managed thousands of athletes and clients and patients with acute low back pain. Less is more. They will appreciate you just giving them the guidance. That's why most people actually go to urgent care or their physician, because they just need to know. They don't want to know exactly what it is. They just want to know, is this serious, long term, and what do I need to do to fix it? That's it. It's the chronic low back pain that want to know exactly what it is. I've been dealing with this, blah, blah, blah. I'm talking about acute and subacute low back pain. What you need to understand is the mindset of the person coming to see you is very different than the person in the mindset with a chronic low back pain. Acute and subacute low back pain is a different ballgame in terms of mentality. They're super fearful. They don't have the chronic pain mindset. What they have is the same fear, but all you need to do is calm them down, help them realize it's just a phase. It'll take this long, 48 to 72 hours, 2 weeks to come after that, and 4 to 6 after that. But most people will get better within that first 2 weeks. But if you see them in those first 2 weeks, that's where it can go wrong. If you manage them in the first 2 weeks and you start applying chronic-based care to that, you're flaring them up. Guess what? They actually get worse. The patient and client that I mentioned earlier, he mentioned that he had trauma and he was given opioids. And he said, is there any other alternative to what I can receive for care? And the doctor said, you can, but you're going to be in significant pain. And this person was fearful of taking opiates. They'd never taken it before. And they started taking it just to relieve the pain. And they had a fractured clavicle or something. And they said within a couple days, they already had that withdrawal symptoms. They had like their feet moving, their legs, they just wanted it again. And they acknowledged that that's a horrible feeling. If you've never been in that stage, you're scared, that you're fearful that your pain's going to get worse and that opioids is the only thing that's going to make you feel better. But he said, the advice that you gave me and what to expect immediately after was the key to saying, I don't need opioids because I need to make sure that my percentages of improvement and my pain tolerance is getting better with time. So if I knew what normal was and I was hitting those milestones, they knew what to expect. But if they didn't have those milestones, they just figured, well, I'm in constant pain, I just need opioids. And that's scary for the people you serve. People don't deserve to be in that mindset. And if you've allowed yourself, because there's a reason why you can't manage acute and subacute low back pain. There's really two main reasons. Capability, you're just so busy in your clinic that you don't have time to manage it in case it comes in, or the capacity is the amount of time that you have available to manage people, and the capability is you just don't have the skill set. So if you work in a place where you have to treat 4 to 6 people an hour and you're like, literally, I can't manage you right now, and you feel bad and you're like, hey, yeah, the opioids are going to help you, or hey, yeah, just figure it out on your own. You'll be fine. Here's a corrective exercise that I use for all my chronic low back patients. That's a different ballgame. But if literally you don't know how to manage them, that's a personal challenge. And I mentioned that on my podcast in the past. If you don't know how to manage people, study, figure it out. And if you don't want to do that, why are you on my podcast? Like, that's a different human being. You really don't care about the people you serve. You better care about them. They're the reason why we all have jobs. It's the reason we have a purpose. And and the challenge with acute and subacute low back pain is that, one, you may or not may have a lot of these patients and clients on a regular basis, and I understand that. But when they come to you, be ready. This is a very rare case, but you need to be ready to manage them. And at Sports Performance, we have a lot of cases that are acute and subacute low back pain. And the reason why I brought this podcast up is because I had the back pain this week, and even with years of history and the people I manage, I still had these thoughts. And I wanted to share that because it's real. Nobody wants to be in pain, including myself. I'll tell you what, like, I do not want to be in pain. Like right now, it just hurts to sit. But I know after this podcast, I'm up and about. I'm moving. I'm walking. I don't care. Movement is medicine. And I know we hear that all the time in our profession. However, when you manage somebody who's anxious, who's right in front of you, they're fearful, you know what you do? You revert back to what all your training has been. Well, chronic low back pain, let me just manage them that way. No, less is more. Give them what needs to happen. Give them the exact timelines. Have them fulfill those timelines. When they come back to see you, just keep guiding them. Just keep guiding them. Acute and low back pain, acute and subacute low back pain, it is real. And if you have challenges with managing these people, send me an email, drchris@drchrisgarcia.com. Let me know, because I think that these people fall through the cracks. And I think if you work in any healthcare system, there's people who fall through the cracks. People who go either urgent care, primary care, they're pushed away, they're given meds, and there's never really a solution. They're just dependent on meds, and they think that they're going to have back pain for life. And I think that those are the people we can serve the most in educating them, helping understand that literally you don't have to take meds. You can keep moving. But having the confidence to have that conversation is a different ballgame. Now, I think that PT school in reality is a different thing. And experience, if you've never been taught that in PT school, you don't get to see that many people in real life with this. It's hard to have that conversation. I'm just telling you from a standpoint of, I've had it, I managed people with it, and they all told me the same thing. I've appreciated what the timeline has been and everything that you've set the framework for. And myself, I need to reset and understand that myself. So for those of you who are new grads, experienced clinicians, I hope this helps with your acute and subacute management. Now, I can give you all the exercises in the world, but your framework needs to be better. That's my mission, is to give you a better framework so that way you can manage those people better. You can insert all the exercises that you want. I don't care what you've been trained in. Great, good for you. However, if you flare them up, too many exercises, too aggressive, they'll never come back and you'll lose their confidence. And that's the worst thing you can do for somebody that you serve. So I hope that helps. I'm sitting here with the subacute low back pain, and I'm feeling better. And I wanted to share with you guys my story, and how I think you can improve your skill set and your outcomes with the people you serve. Take it easy. Less is more. Provide the bumpers. Be honest with them. Transparent. Don't use chronic low back pain principles and flare them up. They will never come back, and you lose that opportunity. And more than anything else, you ruin somebody's life and the mental aspect of pain. So I hope that helps as you go along. And I hope that you can manage these people better. Send me an email. Let me know what your thoughts are. I'll continue to produce this content and help you understand that. But ultimately, it is about the people we serve. Don't forget that. And it is not about just you being the best clinician. It's about you being able to provide the service at all timelines. My obsession is that I think that most PTs are really good specialists from 4 weeks of pain to about 4 months of pain. And I think there's a gap from acute injury to 4 weeks, and from 4 months post injury on to back to sport. And I want to be able to fill those gaps and help you along those timelines. So today was really about this side of the bell curve, the people who are in the acute and subacute phases. And I hope that helps. So I hope you guys are doing great and life is amazing. I hope this kind of brings some new ideas to light. Let me know if you have any questions, and I hope to see you on the next episode. Take care, guys.